Good morning, everyone. Good morning to everyone who's online. Thank you so much for joining us today. Thank you for the show of support on Friday, the last day of the conference. Today's session, which is on scaling urban sanitation in Tamil Nadu, is being co-convened by the Indian Institute for Human Settlements and the Bill and Melinda Gates Foundation. We will be taking you through the Tamil Nadu Urban Sanitation Support Program today, highlighting some of the key lessons and challenges that we have that are coming out of this program. One of the key objectives of this session would be to understand which of these lessons can be transferred to other contexts. And in that regard, we would like your feedback when we get to the group discussion. So before we get into the program, and I'll take you to the agenda in a bit, we would like to understand who is in the room with us today. So we will be running a short Menti poll with a few questions about all of you, where you come from, but also about your urban sanitation context in the country that you're coming from. So with that, I would like you to, I request everyone to please scan this QR code or to go to menti.com and type in the code that's on the screen. And while you do that, I will try and bring up the questions. Yes. The code is 13543402.
Change the screen. Could someone write it on the whiteboard?
Yeah. Yes. We have Middle East and Africa. We've just done it by the regions. Okay. Might need some help. Yep. Okay, so we've got anyone from Europe. Quite a few people from here. We'll just move on to the next question. Most of us from WASH, for distribution across other areas of work as well. I'm going to move on. Okay, so we've got our students here, or faculty. Okay, so the next set of questions are about the urban sanitation context. Hmm. The majority seem to be from
Very interesting.
network.
We won't have on-site system, they're very interested in that.
Yes.
Let's go. I guess this is only applicable if you have
On-site system, so maybe I can just move on.
Yeah, maybe let's move on.
Yeah. Okay. Last couple of questions. So this one's on the sewage treatment plants in your country.
I'm sorry, what do you mean by underutilized?
It's not being used to full capacity if there is,
In terms of people for treatment or just the data?
in general.
Yeah. So this is interesting, even places which do not have on-site systems are underutilized in treatment capacity.
Okay,
You often design it for the future, so the design fits on the 30-year capacity, so is that being utilized or is that?
hmm. Yes, and this is the last question.
Or college towns where students come in and out over the course of the year, so you have to have the capacity
Oh,
in the year and.
hmm,
No state of prevention.
one, yeah. There seems to be. Yeah, this is the last.
So these last few questions was just so that we have a sense of what's happening around, because as you will see that the India context is quite specific. So when we're discussing about the predictability, these are some of the questions or answers we would give.
Yeah, so just take you quickly through the structure of this session. Kavita will start off by setting the context for the program. And then we will have two short presentations. The first one on the initiatives that we have implemented along the full cycle of sanitation, followed by a short Q&A break. We will then pick up on the institutionalization and the stakeholder engagement part of the program, again followed by a short Q&A break. Then we will break out into groups for a discussion around the question that I mentioned earlier, and then finally conclude with some remarks by Jan Willem. So now I'll hand over to Kavita.
Good morning, everybody. There are many familiar faces in the room, but for those who don't know, I'll just give a short introduction. So basically, IHS is a prospective university in India. It's a practice-based university, which means apart from teaching and research, we also do practice work, which is what this program was about. And we also do capacity building, and we focus on urban issues, and we believe in an interdisciplinary approach. So the program is, as she said, Tamil Nadu Urban Sanitation Support Program. And I just wanted to say that three of us are presenting on behalf of a much larger team who's behind this. So this is work of everybody out there. So just to set some context, so this presentation or the program has to be seen in the context of India, where significant progress has been made on sanitation, rural and urban in the past few years. And this is part of that story. So coming to Tamil Nadu is a state in southern India. It's a fairly urbanized state. So you can see there are around 649, over 600 ULBs with a population of almost 30 million. And many of these towns are dependent on on-site systems, either fully or partially. And the last point, cryptic point on institutional arrangement is actually refers to one of the questions, just so that people are not familiar with India. Basically, there are three, it's a three-tiered governance system in India. So there's the national government, state and provincial and city. And we worked with two levels, which is the state and provincial and city governments. And the reason for this is that the city governments in India are financially quite weak. So if you want any change to happen, you have to work with the middle level of government to scale things up. So when I say state, I'll be using the state, but it means the provincial or the regional government. So what is TNUSSP and who are we? So TNUSSP was a technical support unit set up within the government. So I've been asked during the week, are you the government? And the answer is no. We've been embedded within the government as a unit that supports exclusively on fecal sludge management because it was an emerging area of work. And the effort was to scale it across all its towns and cities. You'll see the discrepancy in numbers because we were not working in Chennai, which is a big metropolitan city when we started. And part of that program was actually, it's a multifaceted program, as you'll see, ranging from engineering support to, capacity building to governance and institutional strengthening. And as process of that, we had to engage with multiple stakeholders, not just the government, which will also come later in the presentation. But now we have scaled to the whole state, but when we started off, we had, and this is something important, we were pushing for enabling environment at the state level, whether it was policy, investments, but we were also deeply embedded into cities in the state where we were actually demonstrating technologies, ironing out kinks in implementation, etc. And there were two types of cities. One were small towns of 5,000, 10,000. And if you remember the previous slide, there are over 500 of these small towns. And then one was a 1 million plus city called Trichy, where it was a partly sewered system. So you could actually demonstrate FSM and the complementarity. This slide is just to say this is a fairly mature program. So we're pretty confident of standing here because it's reached a certain scale, reached 200 ULBs, 15 million population, and this is direct impact where facilities have been set up and cluster models are operational. And also we have, it's sustainable, we feel, because we've seen multiple changes in government, both on the bureaucratic side, but also on the political leadership. So this is something that's got embedded, and the process of institutionalization, while continues, has already happened. So we feel that there are lessons from this program to be drawn. And now we'll just play a short video introducing.
With over 30 million residents across 649 metropolitan cities, medium and small towns, Tamil Nadu has a high urban population. Around 69% of this population relies on on-site sanitation systems. The government of Tamil Nadu envisaged total sanitation for all. And to achieve this, fecal sludge management was seen as a viable method to rapidly scale sanitation quickly, both as a complement to network sanitation in metropolitan cities and also as a standalone solution for small and medium towns. This led to the launch of the operative guidelines for septage management in 2014. The guidelines built on Tamil Nadu's strengths across the full cycle of sanitation, one of which is the presence of private desludging operators across the state. To ensure these operators dispose of waste safely, the establishment of adequate treatment facilities across the state was recognized as a critical first step towards scaling FSM. This led to the creation of the State Investment Plan. The plan ensures scaling in a phased manner and is underpinned by two core principles: the saturation of existing treatment facilities through co-treatment of sewage and septage, and the adoption of a cluster approach. Currently, co-treatment is being enabled at around 61 STPs across the state. As part of its investment plan, the government allocated $30 million to construct 51 FSTPs in areas without existing treatment facilities. The FSTPs are simple to construct and operate and are being implemented through rigorous quality assurance mechanisms and digital monitoring support. Through the cluster approach, the 51 FSTPs and 61 STPs will serve a total urban population of nearly 19 million across 264 cities and towns. This unique approach to scaling FSM is also being adopted by other states in India. Once operational, the facilities will be shared by clusters to ensure resource and cost sharing among multiple local bodies. This will be enabled by a memorandum of understanding between them. To sustain the use of treatment facilities and strengthen the existing private sector desludging market, a light touch regulation model is being adopted. This includes licensing desludging operators through a standardized system across the state. To successfully operationalize FSM, the government of Tamil Nadu is engaging with stakeholders across the full cycle of sanitation through capacity building and enterprise strengthening activities. With a specific emphasis on vulnerable stakeholders, various initiatives are being undertaken to ensure inclusion, improved welfare, and empowerment. Through behavior change campaigns targeted at the citizens of Tamil Nadu, a sense of responsibility towards sanitation is being created. These campaigns are bringing FSM to the fore and helping its most critical stakeholders embrace septage management. This has been Tamil Nadu's journey towards scaling FSM so far.
With the film in the background, so I'd like to add on few things on what's being done. So it will be done in, I think, two parts. The first part would focus on the physical part of the full chain, and the second part will be on the institutions. I'd like to summarize the context side of it. I know you have answered some of the questions in the beginning. So we'd like to emphasize on a few things on the treatment and reuse side. So one, we had some facilities, primarily sewage treatment plant, but there was inadequate treatment facilities across the state. So that was the one thing. And we used treatment as the entry point for scaling. So that's a key thing. And second most important thing is that we already had a collection and conveyance privately operated and on-demand service provision through market-led mechanisms. So these are the two key things. So we had collection and conveyance system in place, but we don't know where this has to be disposed. That's why we use treatment as the key thing to enter. And apart from that, we also had some of the typical issues with on-site system, non-standard systems. So that's one of the things. And apart from that, we also had a sort of a unregulated market for collection and conveyance, and also the occupational health and safety issues. So I would like to briefly introduce the cluster approach, and also it will be discussed later in the institutional arrangements. So two or three key things here. So these clusters were created so that the designated facilities are available, and all waste from the cities, which are at a 10 to 12 kilometer driving distance. So they reach these facilities easily. And that 10 to 12 kilometers is also based on extensive consultation with the desludging operators. And also we see that that seems to be a reasonable thing, but we also see in certain locations, desludging operators are also finding it profitable to go to the tune of say 20 kilometers or so. And second, the whole thing started keeping operations in mind, right? So we had STPs which are already there, right? So we need to kind of enable co-treatment in those facilities and continue operating that. So primary treated, secondary treated, tertiary treated, whatever it is. So we need to have operational systems. So that's why, I mean, I'll discuss that in the next slide, but optimization of existing resources and whatever we have planned. So that's the key thing. So let's not have systems which are over designed and then operational costs are substantially higher. So those are some of the things that the cluster approach, had these advantages. So in terms of improving treatment capacity, so broadly, one is that we saturated existing STPs and then followed up by establishing new FSTPs, and also ensure that we improve the O&M side of the co-treatment. So on the co-treatment, some of the key things, we're not looking at very sophisticated way of treating this. So one is you get the waste to the site, ensure that these are easily accessible by the recycling operators. One, their safety. Second, minimum turnaround time, and ensure that there aren't spillages and exposures associated with it. And some of the studies indicated that this could be a place where you have very high risk of exposure. So what we enabled is, one, we improved some of the operation maintenance practices, such as you need to ensure that there is screening and also grid management, and also you have a basic testing so that industrial waste don't get into the STPs, right? So these are some of the things. And second is that we started collecting information. Where is the waste coming from, right? And how much is the quantity? So all of this were also kind of enabled through digital systems. And the second part, where we don't have critical treatment facilities, so we started looking at setting up FSTPs, and I would like to highlight more on what is not the so-called technology-based thing. So one of the key things is, when you plan to set up a treatment system, the difficulty is identifying land in urban areas. So to large extent, we co-located these FSTPs with solid waste management, which is a big win. We had quite a bit of a difficulty in setting up 1 or 2 demonstration plants, but there was substantial opposition from the local residents for setting up such treatment facilities. And we had, in a way, overcome this by co-locating them. And also the approvals were fairly easier. So if you want to speed at scale, so co-location is a simple thing. And second important thing is, whenever we want to set up something, what will be the size and what basis you decide the capacity, all of that. So since it was a demand driven, we do not know what type of on-site systems are there, what is the waste that is being collected. So it's better to go with modular approach. And it has 2 or 3 advantages on the operational side of it. So one, there is a seasonal variation. Rainy season, you have a lot of loads, and during dry, there's hardly any load. So you can have trains which are operational seasonally, and then you can shut off some of them which we don't need. So that's the thing. And then also we looked at multiple options. It's not like we would like to go with 1, 2, or 3. So depending on land availability and what is the skill that is there with locally. So some of these things helped us in deciding what do we want to do, what type of systems that we set up. I think the rest of the things, I think the technologies are fairly well known, and these 3 are the key principles. And from there onwards, if you move on to the collection and conveyance system, we followed a fairly simple approach. We did not disrupt the existing market. That's the key thing, right? So you had a fairly good privately informal kind of a service arrangement. So we tried to strengthen it. 1, by introducing uniform licensing arrangement, and 2, keeping the tipping fee low. Waste should reach the site. That's the objective, right? And also it helps, the moment you start introducing standard licensing, it helps to introduce measures such as how one can operate fairly efficiently, and also the health and safety concerns of operators are addressed. And then there is by adopting some of these measures, you're also increasing the viability and business opportunity for the operators. So with this approach, what's happening is that how do we address challenges of urban poor? Because some of them are unable to afford the cost of desludging. So this is in an early stage. We piloted few things around affordable desludging model, including working with the desludging operators, right? So they had a standard low price for the urban poor, but this is yet to be scaled. But the other important thing is nearly 15 to 20% of the urban population, or basically the urban poor, they rely on shared facilities, community and public toilets. We introduced scheduled desludging there. So through the government system. And now Trichy has adopted this, and other cities are planning to adopt this, and it's being scaled. So next part, this is the most challenging one. You have on-site sanitation systems. So the new systems, to some extent, you can ensure that you can secure through improved implementation of the regulation, but what will you do with the existing ones? So we tried improving some of the existing systems through options, such as one, converting them into standards or improve the functionalities of it. But scaling that is a challenge. But whereas in the large generators, the community and public toilets, for example, or the other commercial, institutional, so these can be scaled through improved implementation of the regulation, but also through government systems. For example, community and public toilet on-site systems can be converted into a standard ones or improved septic tank or equivalent. So that's possible, and it can be scaled through government systems only. But the question on on-site systems for individual household toilets is still a bigger one. So we could discuss that when we do the group work. Once we have all this in place, then how do we want to kind of communicate and enable some of these things, right? So including understanding the full cycle of sanitation and all of that. So we did a little bit of a background thing. So since sanitation is a taboo, so we thought you need to have some sort of a friendly character which talks about sanitation instead of creating a fear. So that's why Kaka Man, very popular character in Tamil Nadu now. So we used some of the, campaigns were focused around what is full cycle sanitation, what does FSM mean, all of that. And also more importantly, certain specific call to action. So that's the focus of our BCC campaign. And we'll play a small video on this. Yeah.
Hello, Nadu, Kakaman. One பொருளை சேர்த்து வச்சு எண்ணி சேர்த்து வச்சு என்னைய சேர்த்து வச்ச சீமானே நான் தான் Kakaman. சீனிவாசன் சுத்தம் போச்சு செப்டிக் டேங்க் அசலஞ்சு போச்சு சீனிவாசன் சுத்தம் போச்சு செரிச்சதெல்லாம் அசலை போச்சு. உங்களுக்கு எல்லாம் என்னடா குறை வச்சேன்? வெட்ட வெளியில போனா வெக்க கேடுன்னு வீட்டுக்குள்ளே டாய்லெட் கட்டி வச்சேன். நீங்க எல்லாம் போய் தங்கறதுக்கு செப்டிக் டேங்க் கட்டி வச்சிருக்கேன். வேற என்னடா பண்றது? செப்டிக் டேங்க் கட்டி சோலி எல்லாம் முடிச்சு சொர்க்கமா இருந்தீங்களே. வருஷ ரெண்டும் ஆற பின்னு வண்டி ஏத்தி அனுப்பி வைக்க மறந்து போனீங்களே. அடித்தடாமும் கட்டாம பக்கவாட்டும் பூசாம அம்போன்னு விட்டீங்க அம்பான்னு விட்டீங்க. மண்ணை தோண்டி உள்ள போய் தண்ணிக்குள்ள தட்டழிச்சு வீட்டுக்குள்ள போறீங்க. உங்களை இப்பவே அப்புறப்படுத்துறேன். ஹலோ
வாங்க. விடமாட்டேன்.
தடுக்கிறீங்க.
அந்த டிரைவர் எங்களை கண்ட இடத்துல கொட்டுறாரு. அதுக்கப்புறம் நாங்க மண்ணுக்குள்ள போகுது நிலத்தடி நீர்ல கலந்து மறுபடியும் உங்க வீட்டுக்கே வந்துருவோம்.
சுட சுட சோறாக்கி காய் போட்டு குழம்பு வச்சு கூட்டு வச்சு பொரியல் வச்சு வாயில வச்சு சாப்பிடுறது என்ன தெரியுமா? டிரைவர் வண்டி எடு.
ஆமா, நம்ம எதுக்கு இங்க வந்திருக்கோம்?
வெட்ட வெளியில கொட்டினா தானே பிரச்சனை. தோட்டத்துல கொட்டினா தோட்டத்துக்கு உரமா தானே போக.
மறுபடியும் தோட்ட வேலை செய்யறதுக்கு நீங்க தோட்டத்துக்கு தானே வரணும். எங்களை தோட்டத்து மிதிச்சு தானே வேலை செய்யணும். அப்போ நாங்க உங்க கைகள்லயும் கால்கள்லயும் தொத்திக்கிட்டு மறுபடியும் உங்க வீட்டுக்கே வந்துருவோம். வந்து வயிற்று போக்க உருவாக்குவோம். கூடவே குடல் சம்பந்தப்பட்ட நோய்களையும்.
ஐயோ,
அருகில் உள்ள கசடி கழிவு சுத்திகரிப்பு நிலையத்திற்கோ கழிவு நீர் சுத்திகரிப்பு நிலையத்திற்கோ அல்லது கழிவு நீர் வடித்தல் நிலையத்திற்கோ கொண்டு செல்லப்படுவதை உறுதி செய்ய தமிழக அரசு பல இடங்கள்ல பிரத்யேக கசடு கழிவு சுத்திகரிப்பு நிலையங்களை கட்டி மழக்கழிவுகளை முழுசா சுத்திகரிச்சு திடப்பொருள்களையும் திரவத்தையும் தனித்தனியா பிரிக்கிறாங்க. நீங்க விவசாயத்திற்கும் உரமா பயன்படுத்தலாம். எந்த நோய் நொடிகளையும் தராம நாங்க உங்களுக்கு நண்பனா மாறிடுவோம்.
நமது சுகாதாரத்தையும் சுற்றுப்புறத்தையும் பாதுகாக்க மல கழிவுகளை முறையாகவும் பாதுகாப்பாகவும் அப்புறப்படுத்தி சுத்திகரிப்பு செய்ய வேண்டும். இல்லை என்றால்
So we can take some questions now. And this is just a summary of what we've just covered. We will be getting into the institutionalization and stakeholder management next. But any questions at this point?
Thank you so much. It was a really nice presentation. I had a question about, since it's a fairly mature model and there are a lot of lessons to be learned. So just wondering like what was, say, the biggest enabler to get the government buy-in, like to secure that municipal bill, which is really important to, build institutional systems and strengthening that enabling environment. So just in terms of like, if this has to be, say, introduced in another city, like, how do you get government buy-in? What was like the feeling for that?
So some of it we'll cover actually just in the next slide, but just before that, I think one of the key things was that the government of Tamil Nadu was committed to getting to 100% sanitation for all, right? Safe sanitation. And I think they realized that they were not going to get it through networks. So what they were not clear about was whether FSM was the right approach and how quickly it could be scaled. So that kind of push was required. And then there are some other things about building credibility with other people, which I'll go into detail. So, yeah.
And with that, sorry, just
Yeah, sure.
by the national level, SPM, was that the motivation for the like state government, or was that even before that they were committed?
Even before that. So at least Tamil Nadu was committed even before that. I think what helped, I'll just answer in the broader context, not just Tamil Nadu and other states. I think the national attention to sanitation definitely helped. And I think the champions in the states could piggyback their thing for FSM riding on the SBM way. But the first part of SBM is Swachh Bharat Mission, which was a national program in India, which focused essentially on access to toilets. Yeah. Sorry. Oh, that's right. So she had.
Very interesting. So just like it showed in the video, you have systems to check that the drivers will not dump in the school and they all go directly to the plant. Is that system in place to check that?
Yes, so one is we are enabling some kind. Can we collect a couple of questions? James, you had a question.
My question was for the great presentation, by the way. My question was more about the spatial size and the range of sizes of these treatment facilities. How many acres or square meters do you range and scale for the cluster-based approach?
Okay, I try to answer that. And then there were two. So I'll answer these two and then we'll come to these other way. So on the question of open dumping, I think there are two things. One is we have an IT-enabled system, which will actually we won't be showing in detail, but we do have an IT-enabled system, which we're trying to focus on. So sorry, just in my line of vision, sorry. And second is what we've also realized is there are specific open dumping sites. So we are monitoring them and getting citizens to work with it. But most importantly, I think we are orienting the desludging operators. And what we have discovered is if it's within the 12 kilometers, and this goes back to James' question, if it's within a distance which makes business sense for them, there is no incentive for them to do open dumping, right? So we are working with them and we've found actually a significant difference in our operational FSTPs where we've done or the government has done orientation. They know where to go. So I think that's been the biggest thing. James, to answer your question of how many acres, I will have to get back to you, but roughly because Tamil Nadu is an urbanized state, we have made sure that basically the distance between city center to city center roughly is not by road, not as the crow flies, is not more than 10 to 12 kilometers. And then we are trying to modify that. So for example, for hills, it will be less. And for if we know that there's a heavy traffic highway, that will be still less. Yeah, I don't have your answer in acres.
So in terms of land footprint for the treatment facility, so we have two different models. So mechanized system, which had a screw press and the MBB ASP equivalent. So that would require roughly around 50 meters square for KLE, whereas a gravity-based system, so just sand drying bed and planted gravel filter, constructed land equivalent 150. So roughly 3 times more from mechanized to gravity. So that's the answer. Did we answer that question? And probably you can share more details with you.
I have a related question.
Yeah.
I'm sorry, I have a technical question, which is to do with the sizing of these plants, and how you decide what volume and what population base to size them for. There's a lot of examples around the world of plants being designed on the basis of, like what is the population catchment area, and there's so many people, and roll these slides so often, and then find out that actually there's no demand, or if there is demand, it grows very, very slowly, which means the plants are severely underloaded to start with. And actually the fact that you can rely on co-treatment with existing wastewater treatment plants basically means the wastewater treatment plants are underloaded. So you can, you're lucky, you can add in the fecal slides. It's a really difficult question to get right, because you don't want to have a malfunctioning plant. You don't want to pay more money than you need to do. So often finding a way to grow over time is a solution. And I was just wondering, you kind of skip over the whole question, like, well, how do you figure out what is going to work in the area where you work? I was wondering whether you had any advice to any lessons to share, any advice for people. Well, this is how we did it and how we came to a good outcome. So does that make sense?
Yeah.
Yeah.
Thanks that you asked this question. Should we collect or respond to this?
Just respond.
Okay. So this is one of the most challenging questions, and so I can briefly tell you how we started. So when we started looking at a specific demonstration location, we went by demand-based sizing. So there were 6 to 8 trucks, and we set up a treatment facility for them. So that's one. Second is that now we wanted to scale. Then what should be the size, right? So one way of doing this is you look at what is the per capita generation and then size based on those norms. So we did the sizing, right? And then the cluster, whatever urban, the cities that are being served by treatment facilities, you looked at what is the likely size. But the key thing here is what government decided is we will secure land for whatever size that is there, because land will be difficult for me to acquire in the later stage. But what they tried doing that is, let's go modular in the sense you go 10 KLD trains into 2, 3, right? So you set it up only 50% of what sizes that we have estimated, and then add based on what is coming in. So that's the thing. So I can give you a specific example. So we started with Pirinaikan Palam at 25 KLD demand-based service provision. But now we see that it could go as high as 50 KLD, and it's a mechanized system. And without much capital incremental, I mean, just with the incremental cost, we could cater to nearly 50 KLD. So it's only the liquid treatment size that we have to kind of ensure that it goes slightly higher. But this is the approach that's being adopted. Seems to be working at this moment.
Note to question. And yeah.
Yeah.
And just to add to your point, I think other governments have approached us and we have a fairly detailed note of how to do the sizing, but we've told them that this is all best guess estimates. So we are advising them to go modular in all cases.
With regard to on-site sanitation and question about how you're approaching containment or management of the effluent from septic tanks, because we know a lot of the effluents in septic tanks has high pathogen concentrations, and often it's just discharged to the drains, especially for septic tanks that are not functioning well. You had a slide that was mentioning chlorination of liquid effluent, and I'm curious to know more about that and if that works well. But if you have other approaches as well for managing the effluent.
Yeah, we'll respond to that. Or we could share.
Just a short answer and then we could take it offline with you. Because
Yeah, I mean, sorry. So chlorination is a thing that we tried with multiple methods, and I have a detailed note on that. I can share that with you. So the improvements focused on 3 things. One is you try and convert non-standard into the standard to the extent possible, including you dispose through soak-away systems after septic tank. So wherever you have space, that's the first thing that we tried. Second is that you improve this whatever on-site system that is there. So it could be sort of improved anaerobic digestion to aerobic digestion, followed by what are the different ways with which one can dispose. So the best thing that what we found is you try and dose chlorine, and a system to dosing chlorine is the thing that we have innovated. So that's the only thing. So I can share the details with you one to one.
Yeah. And I'm happy to take this offline, but I'm curious as to how Kalkaman has gone over. How is he being received, or how have they been received? And sort of my slight fear is these kinds of things, they take quite a bit of effort, and it's well put together. But often the follow-up to see, well, what are people's reactions to it?
Yeah.
That's sometimes not clear, and sometimes not assessed in any way other than it was great and everyone had a good time. You know?
I couldn't agree with you more. So to be honest, it got delayed. So we did it in a couple of cities, and there we have some preliminary, I wouldn't call it impact assessment, but some things of how it's interacted well. It's been a useful tool for us to do much of a community work, right, around access and stuff. So we have anecdotal evidence and at a city level. What happened was the state could not, because COVID hit, state did not have resources to run this at the level we had imagined. But now, as we are talking, actually the team is sitting with the government and pulling it out. So I'll have an answer to your question probably in a few months. But yeah,
will be all over Tamil Nadu.
yes, they're allocating, well, I don't know, budget of a couple of million USD. Musa, we're going to have to move on. We can take your question in the next round.
Yeah, and there are probably going to be questions online as well, but we'll take it in the next round. Yeah. Sorry, can I just get that?
Yeah.
So this is to answer the question that was asked of how did we build credibility. So one thing that helped is that we had a strong government champion in the beginning at the highest level, but also at various city levels we were working with, and they really helped. But one of the things that really helped, we keep on talking about training. What really worked for us was exposure visits. So seeing is believing, they say, and it really worked. We had one FSTP, thanks to BMGM in the country. And we took so many people to that place. And then we took them to countries like Malaysia, etc. I mean, nothing special about Malaysia, just that where the FSM systems had been there at scale and the perception changed. Till then, we were being asked all sorts of questions, particularly around odor control. So that helped. And just to say, even though now we are doing trainings on more technical aspects of FSM, we start each of our sessions still with kind of underlying the credibility of FSM, and that remains the biggest challenge. Also, the second thing is, once we had that, we set up an advisory committee of key government officers and with some development partners, and we were in a way reporting into them. And the reason we did this was because FSM had not been scaled in India, and there were a lot of unknowns, and decision making would have become a roadblock. So that was kind of and we met very regularly, once a month for the first 1.5 years to take quick decision. And I would really say something like this really helps if you're trying to scale something new. We had a similar structure at the city level. It would go, had it ups and down, but that worked. To further answer of why the government invested, I'll come to the bottom half of the slide. If you see the numbers, this was telling them with an investment of as low as 30 million USD, you could cover 75% of urban population. I have to, this doesn't include Chennai, but the rest of the state. And their eyes kind of popped open, and they were like, oh, you know, they hadn't made the connection, like Surat would cost only for 2 cities as much. So some of this thing that they could do it quickly and at low cost was one of the major selling points. And really the state investment plan underlined the approach that Santosh had just said. It codified the cluster approach, it codified the use of co-treatment, and it became a tool through which we had a legitimate thing to go to other like ULBs to talk about FSM. This is just showing, and it was a phase-wise approach. It was realistic. You're not going to reach everywhere soon. Yes.
Okay, so Kavita just mentioned the cluster approach, and one of the ways by which the clusters are being operationalized on the ground is through an MOU. Now, this memorandum of understanding between urban local bodies within a cluster is a unique governance mechanism that the government has adopted and is being implemented. It not only facilitates the operation and maintenance of these shared treatment facilities, but also allows for the costs of operating and maintaining the facilities to be shared between the urban local bodies. And it mandates that the funds that are collected from the other local bodies are ring-fenced. And this sort of helps in ensuring the financial sustainability of the treatment facilities. In terms of just sustaining operations, the other aspects that the government is looking at is involving the private sector, and also protocols and service level agreements have been developed that are being implemented as well. Just in terms of institutionalizing FSM as a whole, one has to recognize that in urban sanitation more broadly in Tamil Nadu, you had the state and the parastatal agencies playing a key role in implementing treatment facilities. But with FSM, there has been a shift toward the urban local bodies. The urban local bodies, which were like often just looking at access, toilets, and solid waste management, are probably now going to be looking at FSM as well. FSM, implementation, building treatment facilities, but also service delivery. And in trying to enable this, institutionalize this, what we did was to map all the urban sanitation processes. And what we found was FSM was missing. As I said, it was largely the focus on sewers and access. So we mapped out the processes and identified the key FSM related roles and responsibilities and assigned it to various officers within the urban local bodies. And this table is a snapshot of that, highlighting some of the processes, what the role of the ULB is, which is going to be the primary implementer of these services. But an important complement to institutionalization, of course, is capacity development, which itself has to be institutionalized as well. And we have focused on multiple stakeholders, both public and private. And we've used different modes of capacity development, training, which are usually the way by which this has been delivered. We have done that. We've done refresher training, but also adopted digital modes. We've used various tools. And I'll just focus on one of them, which is this roving support that we have used to support the government in implementing treatment infrastructure, which Santosh mentioned about earlier. This is essentially small teams that are on the field working with the local government officers to troubleshoot and orient them on various technical aspects, as well as other governance mechanisms that are being implemented. And it's a key feature of the quality assured implementation that we have employed as part of implementing treatment infrastructure across the state. And the QA that we have done, the quality assurance, is quite important especially when FSM has been a new concept and it is being scaled and it is being implemented at scale and rapidly. So you have teams at both the state and the field level that are overseeing this, helping the government implement, but also have multiple tools that have enabled us to troubleshoot, address challenges, respond to key requests almost on a real-time basis. And also with these tools, we have apps, mobile-based apps and dashboards, which is helping us monitor as we go along and as the treatment facilities are operationalized. And monitoring is, from the implementation of the treatment facilities is now being expanded to cover the service delivery as well. So we have an IT backbone that we've developed, and that has many components. From it tracks, the desludging services, monitoring desludging services, right up to FSTP performance as well. So this is being implemented. It's still in its early stages, but is being expanded as we speak. So I'll now hand back.
Yeah, just to conclude, these are very specific to India, so not going into detail, but just to say, as we had the operative guidelines before we joined, but after that, we were working very closely with the government, and government was very particular to make sure that each part was codified in some level. And finally, early this year, we got a legal amendment to the key acts, which is a big thing. Just to say, so that thing was happening in parallel. This is just to say, we've not spoken about our work on inclusion, just to say there were other sessions, not that this was not our focus. And just to wrap it up by saying, so I came to know 3 days back, Jan William is the author of this quote, which is found everything, pilots never fail and pilots never scale. But I think we were very conscious that we were thinking of scaling. So we were not thinking of the best method to implement, but what was the most viable method of implementation that would actually get integrated in the government systems. And for desludging operator, what would make sense for them. So, and I think this is very critical because we cannot do pilots and then hope to replicate them. And I think the government was also very clear on that, to be fair. Second is, if you are going into a new field like FSM, there are likely to be contradictions. Some of the questions asked here, what should be the sizing? Should it be private sector led? And there are disagreements often within the government and often whatever. So I think focus, laser sharp focus on outcome, which was for us was safe sanitation for everybody now, or some form of it, was really telling people, okay, this is the thing, let's keep focus on that, really helped. And I think just as a kind of our suggestion for moving forward, if there are 2 levels or multiple level of governments, just to have teams embedded in at those relevant levels, because the lessons we learned or the messages we got from our team members who were on the ground in the ULB really made this program realistic. We would have never got it sitting in a secretariat with the state government. And yeah, that's the end. This is just summary of few things. I'm very mindful of the time, but we will take a quick 5-minute Q&A and then go into breakout groups, right?
Maybe we will start with the online because we didn't go to them.
I think they're answering online. So
Okay, then
yeah, anybody? I know Musa, you had a question. It doesn't matter, and then we can go on to others.
Thank you so much. The question I had, one, I first thank you for acknowledging or trying to address his comment by saying that in some of the study we've done with you in India, the liquid fraction had more pathogens, and some way to improve or reduce on the pathogen release is having, software pits and having to have some kind of modification to the systems to reduce on the release of that. But some of the question I had was to do with reducing the spillage at the treatment system. That's something you mentioned. And then what you mentioned was you just had to provide pavement and show where the trucks would discard waste. And I'm curious or want to know, how does that going to help with these truck drivers who, with my experience, I saw them that these were almost accidental spillage, which was happening on almost every truck coming, that, they pull out the pipes and things leak, and then they're trying to dislodge. There's a pump, I think, which helps with pumping the sludge that keeps spilling all this waste. I think would be maybe more behavior change aspects that you probably need to put forward and trying to talk to them to see how that could be probably removed, or providing some kind of containment to drain all this waste to one chamber to avoid it from spilling into the environment. Yeah.
So one is spillage management is not just the payment. There's some other details which Santosh can do offline, but on your second behavior change part, so we've not gone into our work with sanitation workers, but as part of our safety work, we have developed protocols and we are working with them to do this and also providing tools. So yes, we are doing that. Yeah.
For sharing this really fantastic work with us. My question is related to, you had working groups, advisory groups that met for 1.5 years. That's really fantastic engagement. And so my question is 2 parts. One, who selected who got to be on those boards? What was the process involved with that and the engagement involved? And then 2, did that membership stay pretty constant throughout like the 1.5 months, or did you have positions on there, like if you had a city mayor, or if there may be positions where if it's elected, for example, if they turn over, does the new person then take the position, or how do you choose members of the board and how stable is membership?
Good. Thanks for that question. So first a clarification, I meant for 1.5 years, they met very regularly for almost once a month. They still exist. These mechanisms still exist, but it's just that they've gone down to once a quarter or something because, there aren't so many, it's not required. The membership was suggested by us, but decided by the government, and the government, basically the principal secretary or additional chief secretary essentially decided from the ease of function. So yeah, I'm happy to have an offline conversation. The membership required pretty stable. There were some changes. So once the changes in leadership happened, they wanted one member out and one member. And of course, they were not specific people, they were roles. So obviously if transfers happened, then the membership changed. Yeah. But to answer your question, at the city level, we've not had local governments, which is a strange thing, but in India, because of legal litigation and many other things, contestation, we actually didn't have a mayor for a very long time. So they were not represented, but we do have, and now they're going to be included in that. Yeah. Maybe James, you can ask your question. I'll repeat for online. Just say.
My question is twofold. One is that your special technical support unit within government, which is a unique arrangement. When the technical support unit is phased out, I imagine that will happen at some time. What's the mechanism by which you maintain the kind of energy and institutional push? Because as you mentioned, in the urban local bodies, the capacity question is really a very serious one, and the empowerment of those officers is also something that would have to change quite significantly for them to be able to carry this forward, it seems to me.
Yeah. Santosh, you want to take this?
I mean, yeah, you guys should add. So one of the key thing is that whatever Mahima was describing, there were certain elements which will happen, say, probably for a short time period. So the thinking is that if we can get to a critical mass, I would say. So if you have nearly 1/3 of ULBs having this ability to understand, run these systems, so I think that is good enough. So even when we're doing the quality assurance of the implementation and the cluster operations, so we had to kind of work intensely with 3 to 5 ULBs, and then they became the peer, whatever, cross learners, right? So, I mean, we had now established around 3 to 5 locations, which are acting as a resource centers within them. So once we attain this, I think pretty much we are there in terms of institutionalization. Second part is, since FSM is now integrated into their routine work, which is kind of mainstreaming, hopefully there will be more and more people who are aware of this and then start contributing towards. And the third key thing is that there have been transfers. So we had nearly 80–90% of the officers between ULBs who got transferred recently, and we had to do a little bit of an intense reorientation out of that. So these are 3–4 things. And we're not saying that we have answered all the questions, but still we have learned substantially in how to manage and develop capacities when you are bringing in these kind of challenges. You want to add anything?
Just one small point. I think a good indicator, like we can't really say it's successful till we actually withdraw, but one of the good indicators is at one point it was just us chasing them, but now it's like they have to submit something and they're like, can we have your help? So we're still providing support, but it's coming from the other side. So, but it's a process still. Okay, very mindful of the time. We're going to reduce our group works to 10 to 12 minutes. But I think there could be 2 groups probably, or 3, but these are, sorry, do you want to answer? These are the questions. Which of the initiatives could be adopted in other contexts? And if you want to specify the context, you could. And also we understand what might be the enabler or barriers. Because we are at a stage where we think that some of this should go to other places, but we would like to hear from you. And these are the initiatives we have kind of listed down. You could discuss all of them or a few of them. That's up to the groups. Yeah. So could we just form 2 groups? Maybe there is a lot of people sitting on that side. That would probably be one group. And then, or if you want 2 small groups, that's fine. And then all of this will be.
Can you show me the questions again?
Yeah, sure. Yeah. And we will keep it short because we run over with the Q&A.
Yeah.
Maybe jot down the key messages.
And do a report out on the top 3 initiatives that you think can be replicated. You think none, that's the bad news, but you're hoping that there will be.
Yeah, which can be replicated,
But you should keep it with stuff.
Three initiatives including.
in the response.
Yeah.
No replication, rather than going on. And if both groups have seen the question, I think what is the norm?
So are both groups working on both questions?
Yes, yes, because the initiative you choose, you will discuss and in the evaluate. Have you seen the questions? Can I?
All right.
I'm interested in that cluster approach.
Tries in the US and Britain and many other places, not all that, but they have this type of regional safety. So the population remains correspond with the geographic. That's a vote. Yeah. I'm going to know that the command works.
Yeah.
I can see it's way that can go wrong.
Yeah.
If we're something they're working very well.
What's your main concern about what you're on?
So being the.
The one thing is just, what's the message that people will see? They know the message they're transmitting. And I'm slightly worried about whether there are any ethnic or cultural implications. As to what kinds of people are coming in as opposed to the whole issue. Your experience. I don't know. But just generally, every time I see you engaging campaign like that. The question is actually how do you answer this? Do people say, what is it?
Don't invest too much in the center.
I said it's not.
Yeah. And then we have the side. When we have the different plans as zones. And the on-site facilities at the house, and then we have this private.
That might be more of an area. As far as the, like, which could be adopted on a contract, probably.
Well, learning from.
The other big one in the United States was the rubbish solid waste management campaign with Native American computer on the campus days. And the one group had the outside the road or something, apparently that was impactful in the United States. Very, yeah. It was the 80s or something.
I remember finding all, it's like every fund wants to buy it all, so fine. We try. They've been trying, but I don't know what happened with it. But you would imagine that it's quite a few are, they're all answerable. Absolutely. That's good. That's about what absolutely. I think they should make the most of the opportunity to learn from it.
I mentioned the cluster approach, what came to my mind was, well, I was thinking of highly dense formal settlements. I'm going to be looking back at some then the first approach was like doers work, but ADRs, like neighborhood level ADRs, and those that struggled as well. Just managing all the many different drive-through schemes. And now it's not a pendulum. Getting back a little bit, something more centralized than not completely centralized. Having district level treatment, so if we have small bore sewers going to, I think more decentralized than this, so we're saying 10 to 12 kilometers, but having small bore sewers, informal settlements, where maybe a few dozen or up to 100 houses are connected. So it tries to avoid some of the problems with complete decentralization. Your teams that manage that number of facilities. So yeah, I wonder if you have something like that cluster approach before in areas where primarily
when you mentioned the media, trying to remember the name of the research that was used in one of the more, but all the decentralized treatment system that we need to overall,
then I think that
and years of use. It's about 1 month, it's
the public sector needs to be.
and one of the things that
Make sure that the council is not making that. So. Yeah, so, yeah, I'm going to give a single.
And so there's so much, and it's quite so very early evaluations.
But they said
and it was evaluated in the house, it's finding this result. So how do we, like say, we have people on stuff. That's the issue. I don't know. 85 years. One thing that strikes me with institutionalization is documentation. This is like such an incredible experience. And I don't know whether resources are available for documentation, but just describing, and that's the hard part, and honestly and clearly with one can. Both the things that work, the things that don't work, the things you don't know. Because it's just like when they were talking about visiting other sites, and always has a huge impact. Somewhere else, there's really been trying. That's what it enormous. So already they're in the position of other areas because they but I don't know how you stop the government distributing public works really on contracts and the treatment plants. They can't be maintained for the very vision on the budget. There's no also there design or solve the problem. But I don't. It doesn't sound like that's happening. That's really the question. Institutional participation.
So I can drop when I think we got something about how to do things. So it's have your treatment for the repair. So. Or if you haven't got to the nature of it, talk to the messages or mention that's also fine.
In terms of initiatives, clustering, we want to learn about Pachamama and see what they're doing. The other ones that people want to talk about. Obviously, we covered. Yeah. I don't think. And so I think it's fantastic that improvement of on-site and on the radar.
Sorry.
I think when I one of the questions that
Okay, we need to close now. My colleagues are being very polite, but we are running out of time.
We don't want to interrupt you, but we do have to be mindful of the time. So, are you ready to report out? Are you ready to report out? Okay, great.
Okay, great.
Okay, let's start with.
If they're ready, then. Okay, I'm just starting.
Make it okay.
Yes.
Yeah, good.
Okay, I think I'm doing already. We can speak.
Okay, I'm pleased to.
Please listen.
I'm pleased to report that our group found 15 key points that we want to share.
We're happy to keep you through the break. Yeah.
I mean, the good news was I think there was a pretty strong consensus from all of us that there's an enormous amount to share here and that's worth sharing. And as for whether or not it's going to work in another place, that's a local question that needs to be answered. But documentation, one of the key points for us is that we think there needs to be a real effort to document what's been done, because there's a lot of rich material. And I think what the tricky balance is, being as clear and honest as you can about the things you know, the things you don't know, and what worked and what worked, what didn't work, and what you don't really know. But there'll be ideas that you tried that didn't work in your context, but that someone else can take the ball and run with it. So we're excited about all that's been learned, and that should be disseminated. There was a strong consensus in terms of the initiatives on the benefits of the cluster approach. That's been tried to various degrees in various places. I know when I was a student here many years ago, we were all excited about regionalization. It's the same idea, maybe on a different scale, but the question was, the boundaries that made sense for water and sanitation aren't necessarily the boundaries that make sense for a municipality's definition. Yeah, that shouldn't get in the way of coming up with a good efficient service. So very clear, people thought that was worth exploring. We're curious about Kakaman. We think it's made an impact on us. But we wanted to know more about what you've actually learned and documented, and some what your findings are about how well it worked, what worked, what didn't. Also excited about the emphasis on the private sector and the desludging, and how the particular economic tricks or financing tricks you may have learned to keep that reasonable. I saw there was low cost for registration, and I wondered what that meant, whether there was any subsidy involved or not. Well, other people are asking those questions. I particularly like the light touch, the idea that you're not trying to come down like a ton of bricks with a big thick manual saying, you comply with this or else, we'll come down on you. Improvement of on-site systems. I think young Willem pointed out that this is something that nobody wants to touch. It's like it's your household, you're responsible for it, and if it's not in compliance, you go fix it, rather than looking at helping to support people in an effort to improve systems. So those are mostly on the initiatives. And one of the key points that emerged at the end of our discussion was the IT-enabled monitoring of services and operational performance. That's impressive. And one of the things we felt we wanted to know more about was whether it was two-way, whether there's a complaint system or a customer satisfaction system, or how does the household feel about it? Well, how does the operator feel about the support that they're getting? And making sure it's two-way rather than just collecting data from people. It's listening to them, whether they're workers or house consumers. Did I miss more points?
Thanks so much, Pete. I like how this group has given us ideas and also sneaked in a lot of questions. I don't have time to answer them. I'm very mindful and I want to give you, but we are going to be around. We are here. Yeah. But we are around, so if people want to talk to us, that's fine. And second group, top three things.
Thank you so much. I hope I represent the group very well. They first gave it a name, called it the West Group. But based on one of the key things that came through from the initiatives, is actually we are in agreement with what the other group has presented. And I think James and so shall say the first thing to think about is improvement to on-site sanitation systems. And in here, they said we need to think about making sure they are resilient to climate change. James raised an issue to do with monsoon and say that's something that we need to make sure the system are resilient, and two, they're sustainable. Sustainable in terms of along the sanitation service chain, they can be emptied, they can be able to do the job. And I think that's when Musa added a voice as well on that to say in some of the work that was done by Pete, and us, we actually found that the containment system is the key source of release of pathogens to the environment. So if that's not taken care of, the rest will not be, less, more important. The other thing that was raised was strengthening of private sector-led dislodging, but we had a disagreement on how you put it forward. And I think, I didn't get the name. I said, I think we need to revise that and probably talk about it as, an integration of the private sector and the government, because they work hand in hand. The government bring in the regulations that really, support the sector, private sector. So if you say private sector led, they will do nothing without the government in play. The third one was behavior change. They said that's very key. And if you don't have the behavior change and communication campaigns going around, then most of the things may actually even fail. So there are 3 points that were ranked. They agreed that all the 5 points are important, but they were looking out for what are the kind of the 3 that could actually be, scaled out and taken to other communities. On the institutionalization, they all felt that the 5 points were really important, but they only zeroed down to 1, where they talked about empowerment of local government officials, trying to see how we could do capacity building of these local people working in the urban sanitation or working the sanitation, and that's what they feel like is more important. Thank you. I don't know if I've left out anything.
Thanks a lot, and it's good to see synergy between the two groups. We've not really engaged with the online audience, but I do want to call out one person, Jonathan Wilcox. Thanks, Jonathan. We've not given you an opportunity to speak, but he's been asking a lot of questions and engaging online. So big shout out for him. And I think we'll come to almost to the end. So could I request Jan William to come, or if we can hand your mic there to summarize, make sense of it, and say from your perspective, what do you think of replicability? Whatever, wherever you.
Oh, if I stand up, I just give people a crick in the neck. It's okay. I'm not so sure I want to summarize anything. It's like, I think you've done a fantastic job of pulling out, the kind of stuff that's going on in Tamil Nadu and that has worked. I think the question of what of this do we use elsewhere and what works is always the important one, really hard to answer. And if I look at the kind of stuff you presented, it's very easy to see like, oh yes, there's a lot of stuff that makes sense, incremental improvement, eminently sensible approach to the point that it's even recognized by the SDG targets, right? We don't have to get to perfection. We can take small steps and get better all the time. I loved the fact that you called out, think of scale from the beginning. That the first person I heard say that was Eddie Perez when he was working on scaling rural sanitation in India, actually, only 15 years ago now. And this assumption that we can test something on a small scale and do a pilot, and then ta-da, something magic happens and suddenly it is really big in scale is patently false. And it's expressed nicely in the, pilots never fail and pilots never scale. But so this idea of what do you need to think of if scale is important and what you're looking for, what do you need to do to take that into account from the beginning? And I think that's a really important realization, just worth repeating. As is the aspect of the work you're doing that I interpret as saying, well, leave no one behind, which is from the service provider, from the service perspective, but also the cost perspective, right? Like how do you enable low-income consumers to pay for the service? And so there's a whole bunch of stuff where I feel myself going like, yay, really nicely, you seem to have thought of a lot, learned a lot. The one thing you haven't mentioned, and that makes me go like, boy, you are so lucky, and how many people in the room working in other countries are as lucky, is that you work in a state where there is a government that is deeply interested in improving sanitation for all people, and not only from the, getting people a toilet perspective, but for the whole chain. And even better, they have money to support it. And so if you were to say, well, that's kind of a precondition for the success that we've had in Tamil Nadu, don't forget the kind of blessing that is, but also the kind of constraint that can be in many other places, right? I do think that none of us ought to engage with this work without engaging with the government, right? Like as an external agency, you can support things for a long time, but in the end, if
government doesn't recognize that they are responsible for service provision and should be held accountable to it, nothing is going to last. And in the end, it doesn't matter who actually does the service provision, right? Like you mentioned, there's disagreement overall. Should it be the private sector? What's their role? Should it be the public sector? We've had that debate. The World Bank is one, spent 10, 15 years saying the private sector should do stuff until they realized, it doesn't actually matter whether it's the private sector or the public sector who does it, as long as you can focus on what does it take to run a service well? What does it take to support the institution, to make sure it has the resources and the mandate to do the planning and the expansion and maintenance of services. And so that's like, let's not have that debate again. Let me not repeat everything that's been said, but I think there's really good points. Don't forget to recognize how lucky you are in working with a government that is interested and resourced. Thanks a lot for putting it together like this. Really interesting.
Thank you so much for those remarks, Jan. That brings us to the end of this session. We have up here some of our resources. You can access them on our website. You can also, I would request all of you to please follow our social media handles. And please scan this code for, actually that would probably bring up a feedback form for you to give us some, comments about this session. Sorry about that.
Yeah. Thanks, everybody. Thanks, because it's Friday.
Yeah, thank you so much for the
So where can we get the resources?
All on our website. Yes.
And also those of you who haven't signed out of their business card, please do.
And also thank you to the people online. So
Yeah, thanks to
that's
people online.
The small but engaged group.
Yes.
And I love all the presentations.
On your one, download and